Thank you all for joining. We have a lot of folks coming in, so we're going to give it a minute or two. We'll give it just 30 more seconds for folks to join in, and then I'll kick us off. Okay, we can go ahead and get started. I know folks are going to keep trickling in, but in the interest of time, I'll kick us off. We are so excited you are here. Thank you for joining our first quarterly convening as part of the Health and Homelessness Community of Practice. We really appreciate you taking the time to join us today. The objective of our quarterly convening today is going to look a little bit different from the ones in the future ones, in that it's going to be a bit more of like a meet and greet style. We wanted to seize the momentum and the excitement that we've built over the last couple of months of this work and get everyone in the room sooner rather than later, to get to know each other, get an understanding of who's in the room with you that's interested in solving and working on similar problems, get a feel for what folks are already doing in this data sharing and data matching space, and possibly take away some insights and learnings that can help you in your own work. So the flavor of today is going to be a bit of a meet and greet style. We have a little bit of content to share as well, which we're looking forward to getting into. But Franny, if you want to tab to the next page, I can get a bit more specific into what the agenda is going to look like. So we've had the welcome. We'll do introductions. I will introduce the Community of Practice team, and then we'll flip it to the audience and everyone here today to hear from you. We are going to utilize the Zoom chat primarily for all of the questions we're going to have peppered throughout this presentation, but really welcome and encourage folks to come off mute. We love to hear from you. Who are you? What are you working on? We have a few different question prompts throughout this meeting, like I said, and we'll also utilize polls as well. And again, the objective today is to get a chance to know who is in the room with you and who's working on similar problems. We'll then provide an overview of the Community of Practice, how it started, some key objectives, and the key tools and resources that we'll be leveraging and utilizing throughout this Community of Practice program. And then lastly, we'll share some really great insights and learnings that we've garnered from our beta tests with Santa Barbara and SenCal. And then we'll leave some time for Q&A. Okay, the Community of Practice team. Who are we? Who are behind the scenes of this program? So the COP team is comprised of folks from 3 different organizations. I'll start with myself and the organization that I'm from. I'm Christina Anderson. I'm a senior manager and the overarching project lead for the Community of Practice. I am with Connecting for Better Health, which is a nonprofit that's focused on advancing health and social data sharing across the state of California. I'm joined by 2 of my colleagues, Julia Murphy and Franny Kiles. The second organization that's spearheading this work is Homebase. They are a national nonprofit focused on homelessness, and we're very lucky to have three of their experts joining our team: Julie Silas, Jose Lucio, and Riley Neve. And last but certainly not least, we're working with Georgetown's Massive Data Institute, and we're working with Eric Janella and Vince Story. They are really the brains behind the technology solution and going to be really instrumental in the technical assistance that we'll be providing through the Community of Practice program. So that is us. That is who is working on the Community of Practice day in and day out. We'd love to now hear from everyone that's on the call now. If you want to flip to the next page, Franny. So again, utilizing the Zoom chat. Would love to hear from you. What's your name? What organization do you work for? What type of organization do you work for? QHIO, COC, managed care plan, FQHC, any other option we haven't listed. What geography do you serve? And what do you hope to get by participating in the community of practice? We'll be looking at the Zoom chat, looking at responses, encourage everyone to do the same thing so you get a flavor of who's in the room with you. And would love for folks to just come off mute. Feel free to just unmute yourself. Feel free to raise your hand. Any brave souls that want to speak today, please feel free. We'll give folks a minute to respond. David McCann, go ahead.
All right, I will talk and not type, and then I'll type and add later. I've met a couple of you before. So I am Dave McCann. I act as a fractional CTO for 9 United Ways. So Orange County, Inland Empire, Bay Area, bunch of them. And I've been involved with DXF and Sophia Chang for about 15 months. And as a former Amazon engineering VP, I've been working around homeless data for 5 years. Started working with Clarity Bit Focus when I was at AWS. And so at the moment, what we're working on in 5 United Ways is a request for housing support referral being built on a referral system, a data payload that we're specing that can be either inserted into a United Way system, can be received from a case management system, can be sent into a medical payer system, or can be shared with a hospital or received from a hospital. So it's a bi-directional exercise. We have a set of engineers, we've got a data payload, um, and then we're also building analytics dashboards for impact on programs. So it's a pretty comprehensive team of about 20 people that we've been running now for 18 months. And I'm here to learn from where you are. I'd like to learn what your insights are from CCH in Santa Barbara. And I'm looking for learnings that can let all of us do this quicker and better across the 28 counties that United Way is focused on.
That's great. Thank you for sharing. And that's right up our alley and what we're trying to accomplish in the quarterly convenings in this broader community of practice. Jim St. Clair, I see your hand is up as well.
Hey, Jim St. Clair. Yep, I have been active in C4BH for several years now, and knowing Timmy and Robbie before he ran off to California Blue, I've been engaging in my role as the CEO and co-founder of MyLego. Our focus is on an identity platform that not only facilitates patient identification and verification for the DXF, but can architecturally encompass the policy dynamics of things such as reproductive health rights, identifying and providing verification for homeless populations, et cetera, and basically different aspects of enabling health equity. And we use a number of technologies and frameworks that are actually derived from similar efforts being done outside this country that we can apply here. So great to be able to participate today.
Great. Thanks, Jim. Good to see you too. Jonathan Howell.
Hi, I'm Jonathan Howell. I'm the IT director for the San Francisco Community Clinic Consortium, so the region is obvious. We are the consortium is a partnership of 12 health centers in San Francisco that are all primarily focused on healthcare for the homeless and underserved and underprivileged populations. The consortium is also the holder for the Healthcare for the Homeless grant in San Francisco. And as such, we cause a lot of headaches for HRSA because we have a completely different model than anybody else in the country, where we subcontract a large number of our services. Actually, we subcontract pretty much all of our services to our member health centers, and then do the data collections. So that makes part of my role the improving the process of collecting the required information for our annual UDS submissions, as well as ensuring that we have data to support our diverse, diversification efforts, or making sure that health equity is achieved by comparing homeless populations with the housed populations throughout San Francisco. Um, so it's a large challenge, and I am always in favor of collaboration. I've like Jim, I've been involved with C4BH for a few years now, and am staying in tune with efforts that are going on throughout California to collaborate and share best practices and brain share in general. I think that's all I have.
Great. Thank you so much, Jonathan. We're really excited you're here. And I really hope to learn from you as much as you learn from us. Yeah. Okay, we've got a lot of great responses in the chat as well. One final ask if anyone wants to come off mute and share a bit more about who they are, who you're with, and what you hope to get out of participating in the community of practice. Okay, we can move on to our next slide. We're going to get a bit into the community of practice introduction overview and what's the genesis, how did this work start? What are the objectives of our work? What's our problem statement? And what are the key tools and resources that we're going to be bringing to bear to this group to help you all in your own data sharing and data matching efforts? So I think I'll pass over to Julia Murphy for now.
Thanks, Christina. Next slide. I just wanted to ground us in the origins of this work. So back in November of last year, there was a think tank. I'm sure many of you were involved in that conversation, supported by CDII, Connecting for Better Health, and the California Healthcare Foundation. And in that conversation, there was a real focus on how do we advance health and social data exchange across the state. Next slide. Coming out of that, there was a call to action around 3 priority areas, one of which was health and homelessness. And so this is the first community of practice coming out of that call for action to really move forward using a very structured problem-solving approach to not only supporting organizations to test and locally implement solutions that actually work in their communities, but to do that in a way that we wrap around a structured learning approach so that we are bringing together into this space many organizations and people who are working on solving these shared problems. We're learning together how to do that. And we're building a community that allows for others to be able to take what we're doing and to really be able to try and test that out in their own organizations and reproduce the results. And so through the course of this conversation, you're going to learn so much more about how we're structuring this, what we're doing in terms of the support that we're providing local communities, but also how we want to learn from you all and have that opportunity to bi-directionally share as we work together on shared goals. And so with that, I'll pass over to Julie that can then start to put this into context for the health and homelessness.
Thanks, Julia. So these are just another beautiful visual of what Julia was just talking about, and really shows where you can just continue to see the housing and healthcare sharing across with housing so important. Next slide. So we put together a little problem statement because we all know that this is really important work, but really kind of grounding it in what we all have experienced over the last couple of years here in California, especially because we're privileged to have a Medicaid program that provides housing-related services. Homebase did a study from data from 2023, and we found that about 25% of those likely eligible for enhanced care management and community supports, we're getting it from people from the population of people experiencing homelessness. It's a population of focus, and we have data sheets on our website that kind of allows you to go look and see what does that look like in your specific community. And we know that only less than 25%, but we also know that most at least 67%, but I think often higher in some of your communities of the folks touching the homeless system of care are either already on Medi-Cal or likely eligible for Medi-Cal. So there's a lot of shared populations that the two systems are serving. And we know that really strongly. And again, you'll hear from Santa Barbara, there's, I think, a 70-80% match. But most people experiencing homelessness who are eligible aren't actually being connected to these really important housing related services that CalAIM is supposed to deliver in general, even in the communities where there's a lot of services being implemented and offered out there. And one of the main barriers is incomplete and disconnected data. So COCs and NCPs can't easily, regularly, or automatically identify who they have in common and be able to share information that is vital to being able to coordinate care and making sure there's not duplication of services or making sure people aren't falling through the cracks. And as we move toward this new benefit under community supports in California for transitional rent, which is starting only in a couple months, getting timely, accurate data on who may or may not be eligible. There are really, really good reasons for the data sharing to be able to happen between managed care plans and COCs, and then ultimately even behavioral health departments to make sure that that benefit is getting to the people who are most in need of it and in a way that is most effective as quickly as possible. So there's just even more incentive coming to make sure this happens. So that's our problem statement. I'm going to hand it over to Christina to talk about how we're trying to solve that problem together.
Thanks, Julie. So now that we're grounded a bit in how this work started and our problem statement, what are we all really here rallying around? I want to spend a little bit of time on what our objectives are, both in the community of practice at large, but also in these quarterly convenings. So you all get a flavor of what to expect as you participate in these throughout the next 15 months. So firstly, we're here to support COCs and MCPs and their partners to co-design, test, and implement solutions that solve the data matching and sharing challenges that they are facing on the ground. So these are COCs and MCPs in the same region that are working together. Maybe they're already sharing data to improve the data sharing, the data matching, and overall improve care coordination for individuals experiencing homelessness. Another one of our key objectives in this work is to develop a low-cost, secure, and easy-to-use solution that folks around the state that maybe are not in the work groups or maybe not even in this community of practice, but also those in this community of practice, can adapt and implement locally. And ultimately, we want this to be scaled across the state of California. We'll get a bit more into this on the next slide. What are the resources that we're developing? How are we enabling? How are we creating this tool, and how are we bringing it to bear and making sure folks have access to it? And lastly, at the center of this work is we're here to engage a broader audience across California to really build the awareness, readiness, and ultimately adoption of these solutions. That's why we're all here today right now. Right now, we're focused on data matching and sharing between COCs and MCPs, largely for individuals experiencing homelessness. But we know that that what we're building and solutioning right now applies to many other use cases. Julie mentioned the transitional rent, for example. So there's a lot of applications of what we're doing outside of squarely the COC and MCP data exchange. Our quarterly convening objectives. So firstly, we want to provide a forum for shared learning and collaboration amongst everyone here. That's really our driving force for these quarterly convenings and also the resources and tools that we're creating. We are focused on making this highly collaborative and a high learning environment for all involved. And part of that will be spotlighting local efforts and sharing the learnings, insights, updates, and other practical tools to support readiness. So we already have our insights from the Santa Barbara beta and Santa Cal beta tests that we'll be sharing, many more to come as we continue that work. We're going to learn a lot through our work groups and the COCs and MCPs that are going to be on the ground solutioning and designing and implementing. And we're really excited to share all of that once we get into that. And lastly, I think this point is pretty obvious, but I do want to call it out that we're here to help organizations like all of you here to understand what's needed to share data to support ECM and CS services for people experiencing homelessness. Maybe, Franny, we can tab to the next page. So that is, we've oriented around how do we start? What's our problem statement? How is this going to work? What are our objectives? How are we trying to do this work? And now I'll get a little bit more into the finer details of the structure of the program. So firstly, it runs August to the end of next year. We've kicked off the work in August. A lot has happened since then. We're so excited to have our first quarterly convening now. So the quarterly convenings are a very big part of our work together. I just talked a bit about them, so I won't belabor the point there, but that's a very big part of our work is these quarterly convenings. The other big body of work that's going on somewhat behind the scenes are the monthly work groups. So this is where the COCs and the MCPs that I mentioned on the previous slide are coming together to co-design and test these solutions and also receive technical assistance from our team here, largely from Georgetown. We have three different work groups. I don't have them listed here. And the work groups, actually, they advance in technological and operational sophistication. And so you can think about like work group 1 is a bit more rooted in just data sharing. There's no PII being shared. Maybe setting up a unilateral or bilateral data agreement if one doesn't already exist, all the way up to work group 3, where maybe now you are sharing PII and you have API integrations. And so we have our first cohort of work groups that we'll share in a little bit. And we'll be bringing in new folks along the way as folks advance into different work groups and also maybe graduate out of them and are fully ready and have effective and efficient care coordination. So that's really the structure of the program. That's how long it runs. We've got the quarterly convening and the monthly work groups. And now I want to flip to our tools and resources. We have 2 main resources, and the first is the Community of Practice Wiki. This is going to be an incredibly rich resource for everyone on this call. We're going to use it as the basis for our work groups. We're going to have tools, insights, templates, case studies that will help all of you in your data sharing and matching readiness and implementation journeys. It's also going to be a forum for participants to collaborate. So it's going to be for folks in the work groups to collaborate live, but also you can message someone through the forum. We'll have discussion forums to keep folks in touch with each other throughout the duration of this program and in between the quarterly convenings. I do want to flip it up really quickly, Franny, if you don't mind me sharing my screen. Give me just 1 second here. So the one thing to note is that it does require a login. You do have to sign up for it. It's free of use. We really encourage you to sign up. I think we've already sent an email out about it. We'll send out another one. And maybe Franny or Riley, we could pop in the link to it now in the Zoom chat. So this is kind of the landing page. Again, just have to create a username. We won't spam you, don't worry. And now I'm going to bring us to the Health and Homelessness Community of Practice. What you'll see here are some of our latest posts. And what's important to call out are the subcategories. So this is how this wiki is going to be organized. We have our resource library. We have the quarterly convenings where we'll have all of the registration links to the quarterly convenings, as well as the recordings and the slides that we're sharing today. Again, we're going to use these to facilitate the work groups for folks to upload their documents. We want, it's not just going to be us uploading information. It's going to be you all sharing resources and insights as well. And then solutions, insights, and tools page is very important. I'm sure you guys will be accessing that a lot as we upload a lot more to it. And lastly, we have the California County Data Snapshot. What we're building here is actually a dynamic table that captures and shows all of the data sharing efforts that are happening across the state of California, and even those that may not be just health care related. So maybe social data, for example. We've started populating it. We have we know of a lot of initiatives already going on, but it's going to be a table and a place for you to add your own initiatives for folks to learn from, what are other people doing in other counties and that kind of thing. So it's a very rich resource. We've linked it. We'll keep hitting on it and utilizing it throughout the quarterly convenings as well as the work groups. We also have the Community of Practice website, which is on our Connecting for Better Health page. Sounds kind of exactly as it is, an overview of what we're doing, how to access the quarterly convenings, how to register for those, how to join. We have an email address if you end up wanting to join the work groups. Anything at all, feel free to email us. And then we also have resources here too, in addition to the wiki. These are more kind of static resources, less the tools and templates that we actually utilize to drive your own data sharing efforts, and more just, those background resources. Okay, Franny, I'll kick it back to you. Okay, so we've talked about the community of practice, what it is, what it's all about, resources, tools, and now we'd love to check in with everyone here. We have a poll, and we'd love for everyone to respond. Is what problems are you interested in solving? And the poll should pop up on your screen, I think. Brandy, let me know if that's not right.
May take a minute.
Yeah. Oh, there it is. Okay. Feel free to respond, select what you want to solve.
And just to verbally say, the last one says not tracking real-time bed availability, but it actually should be tracking real-time bed availability. So if you're interested in that, that's the one you check. Never mind. Maybe I said that wrong. Yeah, you get it.
Yeah. Yeah. All right. We'll give folks 45 more seconds to respond. David, do you have a question or a thought?
Yeah, I do. Thank you. I appreciate the survey. I guess I would like to solve a couple of problems that are not in your questions.
Great.
So
We would love to hear from you.
interested. I think on a survey, it'd be good to have a other. So when you ask questions, ask an other with a text box where we can actually type in something that you might not have thought of.
Sure. That's good
Definitely
feedback.
drop it in the chat.
Yeah, we'd love to hear.
Other.
And you feel free to also just verbalize it, David, if you want to share.
Oh, yeah, sure. I'd like to get this group to advocate for two critical capabilities that we do not have. Critical capability number one is that the MCPs do not have a easily accessible API for Medi-Cal coverage status. And it's a use case we're discussing in 4 communities with United Way, where 211s, and you talk in this group about COCs and MCPs, but you didn't mention under the DXF roadmap what are called non-QHIO intermediaries, and 211s are non-QHIO intermediaries. And so if we stick to the roadmap, United Way is the biggest non-QHIO intermediary in the state. And so we want to be able to ping either PALSOS HHS, and they have 2 systems, or we want to ping all of the 9 MCPs with a common query. I've got somebody on the phone, we're about to refer them to somebody for housing needs, and I want to check their medical status. And there's an API for that, and it's not that hard, and there's no common API. Number one, common API from the MCPs. I'm a software engineer. This is not hard. Number 2, county systems. All the counties are trying to put in their own case management. They're all trapped in 1990s thinking that it's a portal with a user interface. And the last thing we need is another screen. CBOs talk about the 4 screens from hell. We don't need a 5th screen. We need to advocate that counties publish APIs. And we're in 3 counties where we actually want to share data with the county, and their answer is, feed the data in again. I've already got it in, and I want to submit it via an API. So if the counties don't support APIs and the MCPs don't support APIs, our case managers are going to go crazy entering data 5 times. So I'm really advocating those 2 things as the biggest problem that we're facing with United Way on data sharing. I've got a JSON payload. I just can't send it anywhere because nobody can receive it. And the counties and the MCPs are in the dark ages. No offense, love them to join the 21st century and publish APIs.
Thanks, Dave.
Julie knows that I'm shy and retiring.
Yeah.
Thanks so much for sharing that. We have captured that as well. Do we want to share the results, Franny? Or maybe we already did.
We are, yeah, there we
Could
can
be
see.
shared, yeah.
Oh, okay. Okay, great.
Everyone is able to see them.
Okay. I think we can also just jam on the second 2 questions. What would you like to learn? and what types of solutions or tools would be most helpful for this work. Feel free to pop it in the chat. We're also happy again for folks to come off of mute. We can spend a few minutes on these two questions. If anyone want to come off mute and share either of the response to either of these questions.
I'll jump in. Hi, everyone. My name is Maria Dominguez, and I work for Contra Costa Health in the Housing Support Services under Behavioral Health. And we're actively working on developing a new software solution for bed management. So this is very timely and really interested in hearing how other folks have solved this issue and collectively, trying to inform best practices so that we can share that in real time with our IT developer team.
Great. Thanks, Maria. Does anyone else want to share? This has been really great so far. I appreciate all of the responses and engagement. Okay. If nothing else, then I think I'll pass it over to Julie and Eric as well to begin talking about our insights from the beta test.
Thank you, Christina. I think we have the next slide. So we have been very lucky to start working with Santa Barbara County and their partner, SenCal, which is their managed care plan. They only have one in that county. And we can go to the next slide. And they've been working, we have we had some sense starting this, having worked with so many COCs and managed care plans about what some of the problems have been, as you saw in the poll, and some of the things for folks to overcome. And so we thought we would, Georgetown has developed a tool. It's not the only tool that people will be using as we move this work forward, but it is a tool for folks who are starting from scratch or feel like they have hurdles and they need something external to their systems they already have in place. So we've asked our friends from Santa Barbara to come in and talk a little bit about the work that they've been doing. So I think we have Sarah, Javier, and maybe David. And if you all want to come off mute and introduce yourselves and talk about maybe a little overview of the problem and then what we've been able to accomplish so far as we've moved forward.
Wonderful. Hi, everybody. My name is Sarah Brazel. I'm with Santa Barbara County Housing and Community Development. I'm a housing program specialist senior, helping to support our coordinated entry, also with a focus on healthcare and justice. My job for the last few years has been helping to implement all things CalAIM, and our managed care plan, SenCal, has been a wonderful partner in this process and is in great support of the efforts that we're here to talk about today. We have been receiving match lists monthly from SenCal via Excel spreadsheet. And David and Javier can talk more a little bit about how that all happens. But previous to a change in our HMIS vendor, we were manually entering this information managed care was providing with regard to ECM enrollment, either assigned or enrolled, and community supports, that housing bundle, housing tenancy and sustaining services, housing deposit, and housing navigation. I was every month going in and manually entering this information into our clients' profiles or our participants' profiles in our HMIS system. At the time, it was WellSky. We have migrated now over to use BitFocus Clarity, and our efforts now are how are we going to integrate this information, hopefully in an automated way and hopefully in a more real-time way, not monthly, but perhaps even daily would be wonderful. And we know that this information is vital for service delivery for our community. We know that many of our participants are already working with our our community partners and who are also delivering these services. But we also have partners now coming in who are not yet connected to HMIS. So a participant may be receiving services from an organization who is not entering that in HMIS, and we don't know that they're receiving this service or that they've been housed or things like that. So this information really helps to inform service delivery when we're making referrals for things like rapid rehousing. If we knew in real time who they were working with, that would be so much of an improvement in our service delivery model. So we're really excited about the possibilities, and we are very excited about this community of practice because it has really highlighted those pain points and really brought our managed care plan even more to the table than they were before in solving these problems and finding solutions. So now I'm going to pass it over to David and Javier to speak to what we were doing previously and what we're doing right now. Thank you.
Thank you, Sarah. I'll step in next, and then I'm going to talk a little bit about what we've been doing technically, and then I'll hand it off to Javier to, kind of discuss more in depth what we've been doing with Georgetown. My name's David Webster. I'm an HMIS administrator here at the County of Santa Barbara, and so as Sarah was saying, what we currently do is generate a file from our HMIS system. In the case of Clarity, it's using Looker. In another system, it might be business objects. But anyway, generating a list of clients that we have in our system that have a signed release of information, and SendCal Health is on our MOU and on our release of information so that when a client opts into that, they are authorizing the sharing of data. And so we generate the file, upload it to a SFTP folder, a secure folder. SendCal does the match on their end. I think the most recent file, we had about an 85% match. So of all the records we sent, which were around 9,500, they were able to match about 85% of that. I do think we could get a higher match rate potentially, with a little bit more fine tools that I think Georgetown could help us with. And so then we get the file back. And yes, historically, I was sort of manipulating that into a format that Sarah could then use to manually enter the records. So now we're, what I will say about this though is the new method that Javier is going to speak a little more to, and with Georgetown has developed. What we've had to do up to this point is sort of overshare. And although we are authorized to do so, there's really no need to send the client information that isn't a match to SendCal. It's just more potential openings for data exposure. So what I really like about this new sort of technology is that it helps identify the clients that we have in common without us sharing actual client PII, and it just keeps it more secure in that way. So I'll go ahead and pass it over to Javier and see how he'd like to add to this.
Sure, thanks, David. I'm Javier Celedon. I'm another HMIS system administrator at Santa Barbara County. Um, the work that we've been doing with Georgetown, involves using the tool that they've developed to encrypt our data before we send it, and then it gets encrypted again. And I'm sure Eric and Vince can give a much better explanation. But generally, it allows us to send all of this data encrypted, and nobody ever sees it unencrypted. We just get the matches. We get all of that getting back. That opens up a whole lot of possibilities for us. And we've already been successful in sending test data, and they've been instrumental in helping us, get past some of the barriers that we've encountered. Being, a county we have a very strict firewall and very strict, network security policies and guidelines. And Georgetown's worked with us to kind of resolve that. Ultimately, the plan is to, bridge that with, using the HMIS API to, take the data, one, out of HMIS automatically, load it into the matching program, which is then going to match our data to SendCal's, and then, return the matches and load those back into HMIS so that nobody has to enter any of that data manually. The goal is like full automation, and anybody that has access to HMIS will be able to very simply go to their client's profile, see that there's an enrollment there for SendCal. They can see, their history of, how long they've been enrolled and so on. And, we're looking at the possibilities with, custom fields and uploading custom data so that we can also track, what, provider they're assigned to, and, vice versa, also give information that's useful to SendCal, such as, who are going to be the case managers for this, for these clients, who is going to, what contact numbers, do they have available, any information that's going to, make it easier to serve these clients. That's what we're going for. So there's a lot of work that's been going into this, and we're really hopeful for all of the possibilities, but we are moving forward. So thank you.
Sarah, David, Javier, thank you so much for sharing that. Sarah, I wanted to see if you might want to talk for a second about your recent challenge that you're hoping the solution that the three of you have talked about will help solve.
Most certainly. As recent as last week, I had a provider reach out who's currently serving this participant and has programs in HMIS, and their participant had a housing opportunity, and they were desperate to figure out, who we know from our last match list that they were enrolled in housing navigation with a certain provider. And of course, this provider was also outside of our system, so didn't really have a specific contact for who we could call. We had their general number, but not the specific. And the provider in our HMIS system said that they had reached out to that number multiple times, but hadn't been able to connect. And this was really a time-sensitive matter. They needed to get that connection quickly in order to then pursue that housing deposit as well. Number of calls back and forth, emails, almost 2 hours of my time spent on this to track down who was the current provider. Well, we finally got it, but wouldn't it have been wonderful if it was just simply a matter of me looking up in HMI and that information living there. So we're hopeful for that. It will, again, allow us to better serve our community. Thank you.
Thanks, Sarah and Javier and David. I'm going to ask Franny to move forward, and if you can hold your questions or type them in the chat, we will have time at the end for questions. But go ahead, Franny, to the next slide. So I'm just going to pull out a few of the things that Sarah and David and Javier didn't call out, but I think you all did a really good job. The idea is setting up regular automated matching to be able to solve some of the problems that right now are hard to solve. What you heard from in the beginning from Sarah is that they were actually doing bilateral data sharing, even though it was manual. We know a lot of COC and MCPs aren't doing that at this point, and so Santa Barbara was in a good starting place in the sense that they were getting bilateral data, both sharing back and forth. But we are going to be working with partners who that's not the case yet, and that they're only doing unilateral data sharing. And so we hope to be able to problem solve those issues as well. But just the idea of being able to do this quickly, easily, in a very secure, no cost solution that helps everybody coordinate the care and serve your shared clients. I'm going to pass it over to Eric for the next slide.
Sure. Well, yeah, I feel like Santa Barbara did a really good job covering the work. I can just do a little bit of recap. So we installed the the software that we use for the test exchange with Santa Barbara, like live on a Zoom, and we configured it on that same Zoom. And that took less than an hour. And we learned in the process of these conversations that both Santa Barbara and SenCal wanted to exchange more data fields, but they kind of felt like it was already difficult enough to do what they were doing, but ideally they would be getting a lot more data and they would be getting it more often. So shifting to like a weekly cadence at least instead of monthly. And then in terms of learning about the Santa Barbara workflow, a lot of this is focused on saving staff time and helping people have the right data at the right time. And so we found that there are two kind of processes. One was for housing status updates. So I was running through one set of systems, and then the other was for identifying shared clients, running through a different system. And we are trying to unify those into one automated process. We've been learning a lot about, what simplifies compliance. And so, for instance, we initially thought, well, let's just get them to provision an AWS server or something. But it turned out pulling out an old desktop machine from a closet and setting it up and just keeping it on all the time was the easiest way to automate this process. And then because they had an existing SFTP server with SenCal that had all the kind of right user permissions for what the software needed to do, we just repurposed that and wrote our software around that. And then, yeah, we've tested the functionality in terms of using fake data. We set up our own SFTP server, did an exchange, found the right results. We also did a test where, they showed that they could send data to the SenCal SFTP server. So, yeah, I think that's it.
Thanks, Eric. So just before we move to the next slide, I just want to say this is an example of what we did with Santa Barbara. As I said earlier, they were already doing bilateral data sharing, but our hope is in these work groups with our participants, which we're just going to announce in a second, that we work with them shoulder to shoulder to come up with the solutions that they need. So they may be positioned similar to Santa Barbara. They may be starting at a different point. They may already have tools that they're using and they're just not working to the extent that they want them to work. And so their technology experts from Georgetown will help them function at a higher level. They may be doing data sharing and not just ingesting, and they need help with ingesting that data into their current data system. So there's a range of things that people will need, and it's not going to be a cookie cutter solution at all. So what Santa Barbara's doing may be very different. People may be using the tool that Georgetown has developed. They may not need it. So we're just saying that out loud, like we're really trying to meet people where they're at and solve the problems that they are most in need of solving. So we'll go to the next slide and talk about our first cohort of workgroup pairs. We're going to be working with Contra Costa and Kaiser Permanente, Sacramento, and HealthNet, Santa Barbara and San Luis Obispo, who also, they both use SenCal. So we're bringing San Luis Obispo in the next couple of weeks. We'll be working with San Francisco and Anthem Blue Cross, Ventura County COC and Gold Coast Health Plan, and then Santa Clara and Santa Clara Family Health Plan. And as you see, the idea here, as other folks have already said, is these pairs of managed care plan and their COC, their local COC. So those, again, this will be our first cohort. We'll be meeting for the first time as a large group in November. And then the idea is that they're on the ground coming up with these solutions. And as they develop the solutions or workarounds or solve problems, they'll be bringing it back, and we will be bringing it back to the quarterly convenings so that everyone can benefit from the lessons learned. If the tools are developed and they're ready for other people to use, they'll be able to use them. coming back to the group and the quarterly convenings and saying, we're stuck here, and asking the larger community to help problem solve if at the work group level things aren't solving as easily as we hoped. So the idea is that they'll be working more on the ground in their communities over months, and then we'll be coming back with shared lessons throughout the whole process. So that's the plan. And I think we're moving next to poll. I know we're getting close to time, but what we thought would be really interesting is to ask everyone to fill out this poll. It's just a one question. What data are you currently sharing? And it's an open text box, but just do 1 word, 2 words, what you're sharing. We're just trying to get the pulse from everyone on this call. If you're sharing everything, you can share everything. If you're sharing referral data, share that. If you're sharing Medi-Cal status, whatever it is, a range of ECMCS data. So we'll go ahead and launch the poll. And if you can do, again, a very short answer, 1, 2, 3 words, just to give us a sense of the range of what you might be sharing. Give folks a few more minutes. If folks want to give us a thumbs up that you've filled it out. Franny, how are we doing in terms of numbers of answers? Are we at like 40 people have done it already?
Right now well, it's increasing steadily, but we're at about 15 right now.
Okay.
Yeah, so maybe just a little bit more time.
A couple more minutes. Again, if you're not sure, you can say not sure. Okay, I think we're good.
Yeah, we've got about 34% participation.
Okay. So Franny's going to swap, and we are going to show some of those results so folks can kind of get a sense of where we're at. So it looks like this is a little word cloud. Pulls up. Folks are sharing some HMIS data, some enrollment data, referral data, some eligibility data. Hard to tell what some of these are, some ECM data. My goal is that the big word in the middle at the end of December 2026 is everything. Not everything that, not like sharing everybody's information, but everything that's important for care coordination. So that's our goal from this whole project, is that we make it easier, safer, and less costly to be able to share data, meaningful data that helps people serve their clients that they have in common, or their members that they have in common. Okay, we'll go back because we have a few more questions. I know we're getting close to time, but wondered if folks want to just like come off mute or put some notes in the chat, thinking about like our model that we're planning for the next year and a half, what you'd like to be able to do tomorrow that you can't do today. So just like start sharing a little bit. I think we'll probably just do the chat now, just so we have enough time for everybody to raise. Christina, are you watching the chat? Is there anything we should pull from that?
By way of questions or responses?
Or responses or questions?
No responses yet. I guess automated data sharing is our biggest challenge. It's from Carl Burks.
David also has his hand up.
Yeah.
Go ahead, David.
Thank you. Tons of great data, not enough time to ask questions. So I think you broadcast a lot of information, but we haven't actually had time to even ask questions to process it. So I would encourage you next time to present a little less and budget more time for questions. My key question I had, great session, really appreciate it, lots of learnings here. In the Santa Barbara pilot, it is our mental model in the United Way ecosystems that we live in as an intermediary between an MCP and a separate agency, maybe running HMIS, and a bunch of CBOs that we work with. All the CBOs have got case management systems. What I didn't hear of in the Santa Barbara pilot was how are you resolving data consistency with, let's say, 5 different case management systems? So the CBOs could be running, anything from an apricot to a lightning step to another case management system. And we've done integrations at the moment to a handful, but it seems to me end to end, it's not about HMS and just MCP. It's also about intermediary and case management system. Did Santa Barbara tackle that or not tackle that? I couldn't get it from the explanation.
Eric, do you want to take that?
I think Santa Barbara might know more about how they end up. You're basically talking about how do service providers who are also entering data that feeds into the HMIS, but they're also using other case management systems. How do we interface with those case management systems? Is that what you're
Yeah,
asking?
I mean, our mental model is nobody relies on HMIS for case management. So what they all do is they have their own case management system. They also enter data into HMIS and they enter data into other systems. And so to me, data interoperability with the case management system is the front door that we need to crack. And I didn't understand in the Santa Barbara pilot you've done thus far, did you reach out to half a dozen CBOs and integrate the data all the way into their separate case management system?
We're not at that place yet, but that may be something that happens during the work groups. It's just like, first of all, they
Mhm.
haven't even, done an automated data match. They're doing it all manually, and they're not doing an encrypted data match. So that's the first step. And then the next step is for them to decide what data SenCal and the COC in Santa Barbara want to share across each of them and where that goes into HMIS so that everyone else who participates in HMIS has that access. So those are the first hurdles we're trying to get over. And then as things move forward, and if those are going smoothly, we'll also help them solve the bigger sharing with other systems or what have you. But right now, the focus is on data matching and then data sharing between the managed care plans and the COCs, which again, Santa Barbara is further along in the sense that they are doing bilateral data sharing. And right now, not a lot of COCs and MCPs are doing that.
And as we do that targeted work, we're also going to be inviting you, David, and others to come and share because there are other parts of the state and counties that are further ahead in having automated, more integrated systems. And so we would love to learn from you in this work. And so we will be inviting people to come and speak to what are you doing in this space? How can we learn from you as well? And how can we flood that through into what we are doing? So this was just meant to be a first meet and greet, some very early insights on what we're doing to get ourselves started. The work groups will be launching in November. We have our communities. We've been very hard at recruitment, but we would love to learn from you. And so we invite you to go to the wiki and use the wiki to ask your questions. Also, go to the wiki and tell us what we should know that we don't know, because there's lots of things that we should know that we don't know. And also let us know if you want to come and speak and share what you're doing, because we want this to be an open forum. We really do want to have a broad view at all of the work that's going on in this space so that we can learn while supporting very practical, targeted problem solving on specific issues with the counties that have put their hands up and said, we're going to commit time and resources to do this.
And yeah, apologies for not having a lot of time with the Q&A, but as Julia said, we were wanting to make sure that we were level setting, that people knew who was here, that we got some information about the vision of what we're doing, who's going to be participating, and the steps we've been able to take with Santa Barbara, just so that everyone has that basic information. And then, as Julie said, we'll hope to be more engaged as we move forward. So
And we appreciate the richness of the participation in the conversation. We were setting ourselves up thinking we might not have a lot of input. It's wonderful to have so much dialogue, and we will definitely build that in going forward.
So we will see you all the next quarter, which will be in the beginning of 2026. And as Julie said, really encourage folks to use the wiki to ask questions, to weigh in, to share information, to post information. And we hope to have some interesting stuff to share with you as we start the deep work with the work groups. So thanks everyone for joining. And Christina, anything else? Sorry.
No, I think that's great. Thank you so much, Julie. Thank you all again for joining. We've captured all of your questions here. There are a lot of follow-ups we have with folks individually. And David, I've seen your questions there too. So more to come from us in a group setting, or everyone will send out the slides, the links, all this great stuff following this meeting, and we'll have individual follow-ups as well. Really want to stay engaged with everyone between now and our next meeting. This is not meant to be our last touch point before the next meeting. Yeah, thank you all again. This was really excellent, I think, for us and for everyone involved.
Thanks, everybody. Have a good rest of the week.